Hi, I'm Dr. Virginia von Schaefer. Sometimes I get realizations about different ways that we practice medicine that I kind of realize are not really quite right. One of these areas is in the condition of something people call benign prostatic hypertrophy, or BPH. Now, all men have a prostate gland, and prostate glands can enlarge as a secretory gland as we age. And when that happens, it can cause symptoms which can range from just mild bothersome to keeping a person up all night. The prostate gland encases the urethra as it leaves the bladder. So we got the bladder here, we got the bladder here, the urethra passing through the prostate gland, and then goes down and out through the penis. So what can happen is as this prostate gland enlarges, it has a tight sinewy capsule, and so that can cause a loss of circulation in the outer regions of the gland. And of course, the rectum is traveling right this way underneath, and when you go to the doctor and you get a rectal exam, what are they doing? They're palpating the posterior lobes of the prostate gland to make sure there's no irregularity. Well, the situation occurs that as this expansion of the tissue hits that tough sinewy capsule, there is a loss of circulation, both circulation into the gland and removal of waste products and circulation out of the gland. So we can have a situation where prostate cancer can develop just through hypoxia and toxicity locally in the tissues. And most prostate cancers are diagnosed in those posterior lobes. So when someone has an enlargement of the prostate gland, even though cancer may not be diagnosed, the word benign isn't exactly accurate, because as the bladder fills with urine, it will only empty when the pressure in the bladder is greater than the pressure of the prostate gland on the urethra. So, unfortunately, men will experience where they feel they have to go. They empty their bladder to a certain extent, but not fully. And then shortly thereafter, as the urine volume rises again, the patient individual have the urge to pass the urine. This could happen off and on all night long. And I've treated many men who had that experience where, the enlarged prostate gland really caused severe insomnia and great distress in their lives. Well, the solution for this problem, classically, is utilizing certain medications, something called Flomax. There are a variety of different things that can be prescribed, but nothing really addresses the inflammation in the prostate gland, which is the culprit, okay? So a classic old school kind of treatment is the utilization of progesterone suppositories in the rectum, because as I said before, the prostate's here, the rectum is here. So if a suppository is placed, progesterone, being a very powerful anti-inflammatory, can cause that gland to shrink down and decrease the inflammation directly in that area, causing relief for the unequal pressure differential between the fluid in the bladder and the pressure of the prostate gland on the urethra. So many people who have these symptoms need to be monitored for prostate cancer. I would say even a little bit more frequently than once a year. At the same time, I'm seeing many patients who have a diagnosis of prostate cancer and are not getting a full picture of what they may or may not have because the physicians are not ordering prostate acid phosphatase, which is a test that helps us see if there is cancer, is it outside of the gland. Now, there are many good tests that will indicate via PCR and fragments of DNA that indicate might be prostate cancer, such as a 4K score. There are several different ones. And those are also very, very good and can replace the need for a biopsy. So if you have a high 4K score, for example, then it's highly likely that you have a prostate cancer, and it might be more aggressive as opposed to a medium or a low score. Just a little bit word of advice. If I were a man and I had a prostate gland, I would also not want to have a biopsy transrectally. Transrectally involves, again, rectum is here, prostate is here, so the physician can insert a needle in the prostate gland via the rectum. However, this does present a certain issue of contamination because there are certain bacteria in the rectal area that obviously you don't want to seed the prostate with. So transperineal biopsy is another option, and it's recommended if that's absolutely necessary. But if you notice, many men are getting prostate biopsies in multiple quadrants and multiple passes, and this can cause inflammation and contamination in the gland as well. So word to the wise, monitor this symptom and get treatment for it if you have it, and monitor your PSA and PAP, or prostate acid phosphatase, numbers at least once a year. Thank you.